the view from my office is the best in town. This is always tell my colleagues that, they're talking about this cramped space and so on. The view is excellent. However, we are in that helicopter to do a job. And before I started with ultrasound, I was basically just sitting on a piece of paper and writing down vital signs and kind of checking on my patients.
So far, I've spoken to clinicians who use the Vscan Air in relatively traditional clinical settings. But Dr. Nils Overland, who I'm about to talk to remotely, takes benign environments and shakes them up, quite literally. Operating from the back of an air ambulance helicopter based out of Stavanger University Hospital in Norway, Dr. Overland puts the Vscan Air through his paces every time he gets airborne.
Dr. Nils Overland, good to chat to you today. Briefly, to start, just give me a précis of what your day-to-day is in terms of medical practice and how ultrasound really figures in that work protocol.
My medical practice today is working at the air ambulance service at Stavanger University Hospital. We have a helicopter-based service in Norway. And in 2008, I started looking into ultrasound, and especially point-of-care ultrasound. And I was so intrigued about it. So in 2009 to 2013, I did a lung ultrasound PhD. And I went back to my service, implemented ultrasound into the national service in Norway, and the rest is history.
I'm fascinated by the fact that you're using in an airborne environment, particularly fascinating for me because that's what I used to do. Describe to me how you use the Vscan Air while you're airborne.
A normal mission for us would be to go out to, let's say, a cardiac arrest patient. I will do necessary things first. That could be to secure the airway, to start CPR, but quite quickly I will then fetch my ultrasound probe and start scanning. Because at the end of the day, I want to know why the patient has a cardiac arrest. I want to know what happened to him or her. I have so many examples that help me, where I find things that can, guide my treatment, that can guide my triage of patients, that can, make me more informed consultations if I need to call the cardiologist at the hospital and so on. And I always store all images so I can show them to colleagues and so on when I bring the patient back to the hospital. So I feel it's extremely useful. There are, of course, many challenges that we need to overcome with the cramped space and so on. That's why it's important that the probe and the ultrasound screen is small enough. It doesn't take up a lot of space and weight. Also, that we are able to see on the screen. It's also something I have to lean over the patient to get to every part of that patient. So it's challenging. But I think the major thing is the noise. Regardless of helicopter, you have to wear a helmet. You have to have this air protection equipment on. And that means that everyone understands that a stethoscope is totally useless in the back of a helicopter. So to be able to see instead of hearing is just a massive improvement.
And you're also being shaken to bits as well, right?
Yes, of course. And that means that I often drop it as well, and it's really important that it's robust, it doesn't break. There are, of course, when it's turbulence and so on, the probe goes like this and you have to focus. But still, you will always get that one image that will still tell you what's wrong with this patient. So,
what has been your experience on the patient interaction side when you've pulled out the Vscan Air?
So one of the nicest thing I do when I do scanning is actually to use it for vascular access. And if you come to a younger person or even a child, and you can tell them, well, I can see what I'm doing. Sometimes I'm a bit cocky and I say, I will promise you that I will hit it on the first attempt. And those kind of things makes the communication with the patient really good. And again, yeah, I agree with you. It focuses them on that. And maybe they look at the arm and they focus on what you're doing instead of focusing on that they have a lot of pain and those kind of things. And I also like that the ultrasound is actually we still touch our patient with it. So they feel connected to us somehow.
I went up to Horten to speak to the team up there, and Shell Christofferson is the godfather of ultrasound, and I was speaking to him about they had to sort of look outside of healthcare and see what was really happening, and leverage the research and development on smartphones.
I was lucky enough to go to Haiti in 2018. I had a 3 months leave, and I went down there to train some doctors in their country, and they are extremely poor. In Haiti, they have one CT scanner in the whole country. They actually had an X-ray machine from GE Medical there, but it wasn't plugged in. And I asked, why don't you use the X-ray? No, if we plug it in, the whole electricity at the hospital breaks down. And then you understand it's not possible even. But what they do have is the phone. I had actually 3G coverage all over Haiti where I went. And then to have this technology pair with an already existing technology is just so, it's what everyone has been talking about for so long.
When the alarm goes off in the morning on your smartphone, you pick up the smartphone and the Vscan Air that's lying next to it, and it just follows you around all day like your phone.
It's just as natural as bringing a pen and paper and a scissor or whatever I bring in my pockets to do my job. It's always in there. It's a natural part of being a doctor, I would say.